Hello, good morning. This is the review for Bubble Hep, the mnemonic for that you would do on a person who's postpartum, just to check their overall physical health. Also, one of the E's is for the emotional status, so you definitely want to check on that as well. The first B we have is breast. You want to monitor the breast after birth to ensure the mother's safety, comfort, and ability to breastfeed her child properly. I say the ability because one of the checklists for inspecting the breast is inspecting the nipples, if they're cracking or red, or if there's signs of mastitis, which is like an inflammation of the breast tissue, where you'll see red streaking at the infected duct, so where the milk would be coming from. Swelling, pain, or fever are also signs for that. Um, like I said, ability, you want to make sure that the mother is even physically able to. If you have a cracked, bleeding, red nipple, you're not going to want to breastfeed, so you want to monitor them shortly after. You're going to ask her if she is breastfeeding. Give her tips on how to stimulate milk production, such as warm showers or breastfeeding early, even just palpation, gentle, not tickling, touching. Because if not, then you want to give formula coaching. How often? Either way, formula or breast milk. How often? Signs that the baby is having enough, such as a wet diaper. If she's not breastfeeding, you're going to want to tell her to take cold showers, ice packs, or apply cabbage leaves. There's a component in the leaf that, let me see, seeps into the breast and vasoconstricts, which causes less milk production. So if they're not going to breastfeed, obviously they don't need all that breast milk. And encourage them to wear a supportive bra. Now you've covered breast, you're going to go uterus next if we're following Bubble Hep. You're going to check their fundus to make sure that it's back down to the level of the umbilicus so that everything is where it should be, postpartum after giving birth. It says here that every 24 hours it should shrink 1 finger length. So shortly after, days to weeks after your uterus and your stomach, your abdomen will have gone to its original size or what it was prior to giving birth. Make sure it does not feel soft or pushed to the side. So you're going to just, Leopold's maneuver. Obviously, the baby isn't in there, but the same idea, the same spot for making sure that the uterus has returned to its proper place. Next, the BB, we have bladder, the last time they urinated, any signs of UTI. It's like infectious signs. They're not going to be, advanced age, so it wouldn't be the decreased level of consciousness like it would be in older adults. And is there any burning while you urinate? Because then if they have a stitch or like an episiotomy, not that they have that anymore, but still there can be perineal trauma. If they have the stitch, you want to make sure that they're not getting any urine in it. And then bale, bladder, the two B's, the last time they made a bowel movement, explain that it may hurt like the first, I was looking at all the mothers were calling it the first poop after postpartum. You can expect it to hurt, which is a sin, but. And then how to increase gut motility. Obviously, you want to walk, you want to not just remain stagnant, get some fiber, drink some water. Those things will help, promote peristalsis and move it down the line. The next L is, lochia. So we have lochia rubra, serosa, and alba. Rubra, red. Serosa is like serosanguinous. It's like pinkish, reddish, leaning more towards pink. And then alba is when it becomes white or yellow. So the red is expected for 1 to 3 days, 4 to 10 days for the pink, that's serosanguinous, and then 6 to 10 weeks will be the creamy brown yellow. If it returns back to the red stage, you're definitely going to want to consult your provider. That last E in bubble is for episiotomy, and we know from you that we don't really see episiotomies anymore, but incisions or like a tearing, perineal trauma. There's 4 stages, so you're going to, once it's, diagnosed and labeled at which stage, you know how to take care of it as a nurse. But you're going to want to provide that teaching to the mother as well. You're going to inspect for redness, edema, drainage, bruising, approximation, so how well that it's healing together. And then you're also going to check for hemorrhoids. They're very common after giving birth. And witch hazel are to be rubbed on those hemorrhoids. That's what you would tell mom if she had it. Homan sign is for DVTs. It's not like really protocol anymore, as you told us, but they still partake in it. Homan sign. Inspect for pedal pulse and edema before attempting. You're going to have them dorsiflex the foot And if there's pain when it comes back, then they possibly have a DVT. So you're gonna investigate further. But I mean, it's a good telltale sign. The emotional state, the baby blues, they're common. It says here that you still have a feeling of purpose and feel attachment towards the baby, which is a good thing, but you have those emotional swings. There might be times where you're like, I can't deal with this right now, even though it's your child, but it's totally normal. I mean, the flood of hormones, any which way you react is completely okay. And then after 3 weeks to 3 months, it's considered postpartum depression. That's when you feel a disconnect between you and your child, lost feeling of purpose, staying in bed all day, don't want to get up. That's what I was saying. Like sometimes you just don't even feel like dealing with it, which is a sin because obviously day 1 to 3 months is a crazy time to have a child. Like you're going to want to be with them every single moment, but if you have the postpartum depression or the baby blues, you're not going to be feeling probably how you thought you would prior to giving birth. And then the P is for pain. You want to get the PQRST, the pain level 1 to 10, the precipitate, what brings it on, quality, does it radiate anywhere, the severity of it, which would be the numeric scale, and then time, how long does it last, is it worse in the morning or the night after you just get up or just go to bed. So those things you're going to want to look into. And yeah, that's all of it. There are postpartum pain relief techniques, but other than that, that would be your bubble HEP assessment. Head to toe, you make sure mom's okay shortly after giving birth.